Good morning. Welcome to today's presentation titled Identifying Drug Endangered Children, a Collaborative Approach. This webinar series is made possible by a grant award from SAMHSA, the Substance Abuse and Mental Health Services Administration. We're excited to provide this virtual series during the month of September, which is National Recovery Month. Today's session is being recorded and will be uploaded to the CMH YouTube channel for future reference. Please feel free to use the chat box to ask questions and add comments you have at any time throughout the webinar. And if time allows, we'll do our best to answer as many questions as we can at the end of this presentation. Our presenters today are Libby Trubeck and Marty Washington. Libby is a department analyst with the Michigan State Police Grants and Community Services Division and currently serves as project coordinator for the Michigan Alliance for Drug Endangered Children, or the Michigan DEC. Marty recently joined the staff at National Alliance for Drug Endangered Children as the Director of Alliance Development and Support. Previously, she facilitated both local and statewide alliances in Nevada, focusing on domestic violence, sexual assault response, elder abuse, and drug endangered children response through the Nevada Office of the Attorney General. Marty has a background in social services and has worked on behalf of vulnerable populations for her entire career. And with that, I will turn it over to our presenters.
Thank you so much, Sarah. Thanks for having us today. We really appreciate the opportunity to speak with you all. I'm Libby Trubeck. I'm with the Michigan State Police and the Michigan Alliance for Drug Endangered Children, or Michigan DEC. And I'm joined today by my partner at National DEC, Marty Washington. We will get right into our training. But before we do, just a quick acknowledgement here that Michigan DEC is funded by the Opioid Affected Youth Initiative, or OAYI, which is a grant from the Department of Justice, Office of Justice Programs, and Office of Juvenile Justice and Delinquency Prevention. Just a little bit more information about OAYI. The MSP Grants and Community Services Division received this grant in October 2019. It is a 3-year, $1 million grant, so we're currently funded through September 2022. And the key components include creating a multidisciplinary task force, using data to develop strategies, and implementing public safety, intervention, prevention, and diversion services for youth and families affected by opioid use. So the multidisciplinary task force is our Michigan DEC Alliance. That is a statewide leadership body with representatives from various departments, including state police, Department of Health and Human Services, Department of Education, and other organizations as well, such as the Children's Advocacy Centers of Michigan, a couple different regional prevention coalitions, and other partners. And so one of the primary ways that we are implementing this OAYI programming to address public safety, intervention, prevention, and diversion is through our education and awareness campaign about the DEC approach. And we'll bring that to you all in just a few minutes here. Our main goal with OAYI and Michigan DEC is to reduce the harm experienced by youth and communities that's caused by caregiver opioid and substance use disorders. And by caregiver opioid and substance use disorders, we mean a caregiver's substance or opioid misuse that interferes with their ability to parent. And to reach this goal, we are working to improve statewide data collection and sharing. We find that often there's a lack of data sharing and communication between partners, as well as just kind of a lack of uniformity in terms of how data is entered and collected and reported. So we're working to improve that. We've established the Michigan DEC Alliance at the state level, and we're currently working to further develop local level DEC alliances to expand our work, local being at the county, regional, or tribal level.
Good morning, everyone, and thank you for joining us. National DEC has been around for over 20 years. It started out really with a law enforcement bent where the agency was looking at prosecuting the drug users, removing the children from the home. And over time, it became very clear that the children are impacted by their parents' drug use. And we need to intervene in their lives because we're starting to see them. If we don't intervene then, we see them later on. So gradually the mission of National DEC became more of a collaborative community approach, involving all the different disciplines. And so with that, evolution, we have our mission statement actually evolved a bit. So currently, the National Alliance for Drug Endangered Children's mission is to teach early identification, response, and appropriate intervention services for children and families affected by parental or caregiver substance misuse. We equip comprehensive multidisciplinary alliances, communities, organizations, and individuals with access to our National Resource Center, trainings, and technical assistance. Now, we couldn't get this video to play right here, so I'm going to do an experiment, okay? So I'm going to be exiting because I think I can get it to play this way. Oh, Libby.
It may be loading, it looks like.
Okay. We're going to give this just a couple of seconds, and then we weren't able to, in the practice session, to get this to load. So we're trying. Oh, here it goes. Oh. Okay. Have we given it enough of a shot?
I think so. It was a good
Darn
try.
it.
Technical difficulty.
Yeah. Yesterday I was able to get it to do it. Darn it. Okay. We're going to go on because I don't want to waste you guys' time. Okay. So when you're talking about drug endangered children, it's really important for everybody to understand exactly what we're talking about. So this is the definition that the National Alliance for Drug Endangered Children has adopted. Drug endangered children are defined as children who are at risk of suffering physical or emotional harm as a result of legal or illegal drug use, possession, manufacturing, cultivation, or distribution. They may also be children whose caregivers' legal or illegal substance misuse interferes with the caregiver's ability to parent and to provide a safe and nurturing environment. So here in Michigan, you may have another definition that your state uses. We're not saying this is the only definition, but it is important for you to understand, for the purposes of this PowerPoint, this is the definition we're working from. The mission of National DEC is 100% healthy, safe children, families, and communities free from the negative impact of substance misuse and drug activity.
All right, so we know that there are 2.1 million children across the US who live in a home with a parent who uses illegal drugs. However, this number is most definitely underreported. A lot of times children in these situations just are not identified by different service providers who may be missing them, such as child welfare, law enforcement, other disciplines. The other issue, as I mentioned briefly in a previous slide, is that sometimes that data just is not reported in a uniform way, so it might not be reflected in national reports. So, 2 million is a huge number, but keep in mind that it's actually larger than that. And so the 2.1 million was children who live in a home with a parent who uses illegal substances. And when we add one other adult, whether that's a friend or relative, just one other adult into the mix, that number jumps to 9.2 million. So that's a huge increase from just over 2 million to just over 9 million children. And again, another thing to keep in mind with this number as well is that this is also underreported due to lack of identification and lack of uniform reporting. So, we've kind of shown that the population we're talking about, drug endangered children, is a huge number across the US, and there are really significant risks for these kids as well. So just a couple are that children whose parents misuse alcohol or other substances are 3 times more likely to be abused verbally, physically, or sexually. and they're 4 times more likely to be neglected than children whose parents do not misuse alcohol or other drugs. And another risk, kind of a more long-term risk, is that children of parents who have substance use disorders are more likely to develop their own substance use disorders later in life, which kind of speaks to the multi-generational effects of substance misuse and substance use disorder. A lot of times those adverse experiences that children have stick with them into their adulthood and can then affect their health and livelihood then. So, we see that there's a huge population of drug endangered children, and they suffer really serious immediate and long-term consequences. And here we have a video that I believe will play just fine. And it demonstrates that children oftentimes imitate the behavior they see from adults in their life, whether that's positive or negative. So again, just kind of goes to the impact that drug endangered children face from their environments.
It looks like rain again today. Dark clouds gather and fill the sky. Don't know how to talk to you, just know how to say goodbye.
Have you actually got a driver's license? I don't think so.
Go back where you came from. Learn to speak English.
Go back where you came from.
Is that what you think?
Oh,
So yeah, it's kind of a pretty heavy video, but it demonstrates, like I said, just how impressionable children can be. They're really dependent on the adults in their lives. And that can be good or bad. As you see at the end, there are times definitely when children model great behaviors because of their caregivers. So just want to keep that in mind, that they're always watching.
it's also important to understand that even though drug endangered children are living in a very challenging environment, it doesn't mean that the parents or caregivers don't love them with all their heart. Addiction can be a very strong disease, and it can affect how you parent, etc. Now, I know that the audience of this webinar is, it's the Recovery Summit, so addiction is not something that is a new concept for you. But once again, I'm going to bring up the importance of working from the same definition, so we understand exactly what we mean when we talk about addiction. This definition was shared by experts in the field with National Alliance for Drug Endangered Children. So for the purposes of this PowerPoint, we are defining addiction as a chronic relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes in the brain. It's considered both complex brain disorder and a mental illness. And as you work in the DEC community and you're bringing different disciplines together, everyone might have a different working definition. So that would be one thing you would want to do when you work collaboratively together, is make sure you're all talking the same language. The other piece of addiction is the nature versus nurture concept. And I'm going to give you an example of a research study a little bit later in this presentation about this. But nature basically is what you're born with, and nurture is the environment that you grow up in. Libby just showed you a video that really speaks to how much children are affected by the environment of the home.
All right, so here we have a pretty simple statement. Children plus drugs equals risk. I think that's pretty straightforward and probably something that we can all agree on. Children who are exposed to substance use, sale, manufacturing, all of those different ways that substances and drugs can enter a family and a child's life all pose some sort of risk. And, again, going back to the importance of having a common definition in terms of building collaborative relationships, we wanted to provide a definition here for risk so that we're all operating on the same page here. So we're defining risk as the chance of something going wrong or the danger that injury, damage, or loss will occur. So, now that we've kind of got the same definition of risk and we understand who drug endangered children are and the ways that substance misuse and drug sale or manufacturing can impact their lives, I think, we probably can all agree that all drug endangered children, all children who are exposed to some sort of substance misuse in their homes or in their lives are at some sort of risk. But of course, families are all different. There can be different situations, different risk and protective factors at play. So we know that risk, how much there is, and risk for what will vary depending on the family. But there's always some degree of risk there.
Let's look a little bit at some of that variation. The National Center on Substance Abuse and Child Welfare found in a study they did in 2019 that 15%, it's estimated that 15% of births across the United States annually are affected by substance exposure. So we're talking about huge numbers here. Because so many factors could be involved, we can't say exactly this happened and this was the result, but we do know that drug-involved pregnant women tend to have poor prenatal care. They tend to not eat right. Their children are born early and they return home after they're born to a very chaotic environment. And all of this could affect the baby. Of course, all of this, as Libby just got finished saying, all of this varies depending upon the substance use, how often they're using, how long they've been using, and how much they use during their pregnancy. The fact of the matter is we all have an opportunity to make sure that professionals and adults that come in contact with children are aware of this. So after they're born, what kind of risks are we talking about? These are children who live in a home where there may be many non-relative adults coming in and out. There could be a chance for violence. There could be a chance for accidental ingestion of drugs. If there's a lot going on in the house that is involved with drugs, the children aren't supervised possibly as much as other children might be. Usually when you hear about a child wandering off down the street in their diaper, you want to look very closely at what's going on in that house, that child, it could be an honest mistake, but it could be drug involvement. Money or priorities could be placed elsewhere and not with the necessities of what that child might need. These are also kids that go to school unprepared all the time because their parents don't have the capacity to make sure the homework is done, that the permission slips for the field trips are signed and sent back, etc. There's a strong correlation between substance misuse and domestic violence. Domestic violence can occur in many situations. I'm not saying that drugs are the cause, really, I'm not saying that. But there is we have seen a correlation. Co-sleeping with a baby and being under the influence and not realizing that you've suffocated that child. I think I talked about ingestion and exposure. If you've got drugs out on surfaces, or even if they're being used in the presence of a child, they could test positive on their skin. And in my mind, one of the saddest things is that you think a parent would never sell their child for drugs, but actually it happens more often than you realize. And what I was shocked to find out is it happens more often with mothers than fathers. And me as a mother, I thought there's no way a mother would ever sell their child sexually for drugs, but the child is at risk for that. So there's different factors when you're talking about drugs being in the home. We've got use and possession, and certainly both the parent and the child, there's risk here. The parent is at risk of overdosing. The parent is at risk of being so incapacitated they can't take care of their child. And this is just using and possessing the drug. Distribution, you have the risk of a home invasion or violence happening in the home. You also have risk with manufacturing cultivation. Sometimes, you know, we're not just talking about methamphetamine here anymore. I mean, this whole DEC movement started with the meth labs, but we've moved beyond that. But still, there's a lot of drugs that are packaged in a way that makes them really, really enticing to a child. I'm thinking of the gummies that look delicious to me. I can imagine if I was a child, they look delicious. They don't look like they should be off the table for that child. So there's a lot of risk. There is risk if you are, if you're cooking meth or anything like that, obviously, explosion, getting the residue on your skin. The residue also can be found on surfaces throughout the house. So it's not just, you know, smoking it that you could be exposed. And here's an example from Salt Lake City. The law enforcement served a warrant on this house, and they came in and they found the adults were packaging the cocaine when they came in, but there was a couple of different side rooms there. And I don't know if you can see the top picture is a little 3-year-old girl, and she is sitting in a dirty diaper, and they have her in a playpen with a door on top she's being supervised at this point. And then at the bottom, you see their 4-year-old little boy is all alone in this chaotic room right here. And I can tell you that both of these children tested positive for cocaine.
Thanks, Marty. So yeah, pretty, I don't want to say good, but, you know, compelling example there. And then in terms of distribution, there are several different ways that children can become victims of the illegal drug trade, several ways that they can be exposed to those substances. So that could be things like a home invasion, abduction, ransom. And, you know, those might be things that a lot of people would think doesn't happen in their community. That sounds so serious and scary. And I think we'd all like to think, oh, that won't happen near me. But one thing to keep in mind is that, especially when we talk about abduction and ransom, sometimes those things aren't really reported as kidnapping necessarily. There's a lot of fear from parents and caregivers. They, you know, are probably reluctant to call the police and say, oh, my child has been kidnapped because I, you know, was selling drugs to this person and owe them a lot of money or something like that. A lot of caregivers or parents wouldn't be totally willing to say that and might instead report children as just missing. So that's something to keep in mind, that, you know, a lot of times we don't maybe see the full picture until service providers from law enforcement, child welfare, prevention, other community groups come together and kind of take a closer look. And then a few other ways that children could be affected include drugs or other substances being transported in children's items. So maybe that's backpacks, diaper bag, even clothing. And that happens because, you know, people who are looking to distribute drugs think that authorities won't be looking in children's items. Children may also be brought along to drug buys. Maybe there's no other childcare or babysitters available, so their caregivers just take them along, which, of course, you know, going back to risk, is a very dangerous, very risky situation. There's a lot of things that could go wrong, a lot of injury that could potentially occur to children in those situations. Children used as decoys could also be used kind of as lookouts. Maybe they're, out in the yard, supposed to be paying attention for police cars or other sorts of presences in the neighborhood that would be, detrimental to the parents' drug trade. So those are just a lot of different ways that children can be exposed to this distribution of substances.
I think we've established that these children, drug endangered children, are a very high risk population. And because they're a high risk population, they have special needs. So it's really important for all of us who work with these children to understand what long-term consequences being exposed to drugs by a parent or a caregiver might have in the child's life. Because if we understand what the long-term consequences are, we can implement some strategies that might be effective. So let's look at some of those long-term effects right now. Emotional, behavioral, or cognitive problems. We see this clearly. Every child is different, but we see that children who have grown up in a home like this tend to experience more anxiety or PTSD or act out, be hypervigilant to everything that happens. They tend to be parentified out of necessity. Sometimes they have to take care of themselves for a couple of days or more. So it's really important. So at a minimum, it's really important that the professionals that are involved understand child development and recognize these special emotional, behavioral, or cognitive issues. And and the reason why we always advocate for working multidisciplinary efforts is because everybody's going to see a separate piece to the puzzle. For example, a child might recognize that the teacher might recognize the child doesn't pick up on social cues when they're in school. And those kinds of skills are really important as you become an adult. You have to be able to read people's body language and pick up on cues that tell you when to stop talking, or when it's appropriate to be paying attention, or appropriate to take care of yourself, etc. They have a hard time paying attention in class. Now, other professionals may notice this too, but if the teacher comes in with that perspective, and maybe child welfare comes in from the perspective that, oh, this child was acting out sexually, so there must be something, they must have some mental health issues. Well, they may, and it may be due to being drug exposed. So that's why it's so important to get the perspective of everybody, so we all bring our little pieces of the puzzle and what we have experienced together. This is, we're going to show you a short video that talks more about the long-term consequences.
Manufacturing or distribution or use of illegal substances in the home or in the place of residence that the child is living in really gets in the way of a parent or a caretaker being able to provide what we need to provide for children. And a lot of kids growing up in those environments, they've mastered a way of being very secretive about what's going on in the home and very protective. Kids that have grown up in chaotic environments where there's been illegal drug use and other issues going on in the house, they really need to know that even if their parents are not able to get off of drugs or alcohol, that they potentially can heal from the effects of growing up and that kind of a situation.
All right, so the importance of intervention, as we've said, this is a huge population of drug endangered children, and there are really serious immediate and long-term consequences. So that makes it just all the more important that we're able to identify these situations and intervene at the earliest possible opportunity. And again, just some of those Some more effects are that children who experience child abuse and neglect are 59% more likely to be arrested as a juvenile, 28% more likely to be arrested as an adult, 30% more likely to commit violent crime. And we know that there's a link, there's some correlation between child abuse and neglect because 2/3 of people in a substance misuse treatment program reported being abused or neglected as children. So oftentimes those things go hand in hand, and both, of course, have really serious negative consequences or outcomes that may happen. And that, I think, like I said, speaks to the importance of why we want to try to identify these children. And as Marty said, it's important to have a multidisciplinary team working to identify and intervene for these youth, because we'll all see something different depending on our educations and backgrounds, work experience, whether that's in law enforcement, child welfare, prevention, other sorts of services. It's important to have everybody working together to be able to identify and intervene appropriately for these youth. And, as we've said, this is a huge population. A report of child abuse and neglect is made every 10 seconds. And in 2019, there were 4.3 million reports or allegations of child abuse, and those reports involved 7.8 million children. So again, just a huge population that we're talking about, and it's really important to try to intervene as early as we can and provide better supports for this population. So this is an example. It's a real life story from one of our National DEC partners of something that happened in his community before they knew about the DEC approach and the DEC mission. So, I should say that it's something that would not happen in the same community today, because they now have better collaboration between service providers who are interacting with this population. They have a strong DEC alliance and really have a common goal of supporting the children's welfare and identifying them in these situations. Sometimes different service providers don't have children at the forefront of their work, which is not because they don't care, but just because they're not aware of how they can identify and what they can do to support this population. So this is kind of an example of that. So there was a situation where a girl went to school on her 10th birthday and told her teacher that her family was involved in the illegal drug trade. So, she confided in somebody that she trusted, a trusted adult, her teacher, and the teacher then passed this information along to a school resource officer. The school resource officer in turn passed this information to a local law enforcement task force. So combined with this information from the daughter and from other sources as well, this task force was able to obtain and execute a search warrant. And when they did that, they discovered everything that the daughter had said they would find, including a meth lab in the home. But, unfortunately, there was kind of a lack of communication and collaboration here. The school resource officer did advise the task force, but the task force was not working closely with child welfare or other sorts of services for youth or for families. So that resulted in them executing the search warrant that evening, the evening of the daughter's birthday, when she was at home. So she had to witness the task force come in to her house, arrest her father. Obviously a very traumatic situation that, with more input from child welfare professionals and potentially other services, other organizations as well, that could have been avoided, because, child welfare would have advised the task force not to do it that night, to wait until probably the next day when the daughter was back in school in a safe environment and she wouldn't have to see all of this happening. Another thing too that could have happened, the task force, if they had communicated more with child welfare and other organizations in the community, they could have been looking out more for signs of children in the home. So maybe there were other kids too. They could have taken a child welfare worker, which in Michigan we call them CPS caseworkers. They could have taken one of those field workers with them to help look if there were possibly other children in the home that might not have been in school. So just kind of a lot of missed opportunities there that, like I said, wouldn't happen again in the same community today. The other unfortunate thing that happened was that the father was informed that some of the information that allowed the task force to get the search warrant was provided by his daughter, which, you know, again, that's something that really should not have happened. It's obviously pretty traumatic, pretty risky for this daughter, for her father to have that information. It obviously made him very upset. And this is, you know, how he reacted to that. On the next slide, we have a recording of a phone call he made from jail to his daughter. And again, just a warning, it's pretty heavy, a little bit, a little upsetting maybe, but it's I think a compelling example of what lack of communication can cause for drug endangered children.
From jail, Richard phoned his daughter, venting his rage in a message monitored by police. Are you there? Yeah. Oh, how does it feel to know you just sent your dad to prison for a long time? No, you're not sorry. You had no business saying this to anybody. All you had to do is say something to me or Grandma. What business did you have? We're going to run your off of school. No, sorry, my ass. Real sorry to it. Answer my question. Why did you go run your off of school? No, you didn't have no business. Thank you. Thanks to you, I'll be spending a lot of time in prison. I'm done talking to you. Bye.
So like I said, pretty unfortunate that this happened to this young girl. You know, I'm sure it took a lot of courage, and it was probably something that she had been preparing for a long time to even disclose this information to her teacher. So that took a lot, I'm sure, for her to get to that point. And then after doing that, this is, you know, how it ended up for her. She just got this call from her father. I'm sure that caused a lot of trauma that stuck with her for a long time. And, you know, we've talked about how there are immediate and long-term consequences that children face because of their exposure to substance misuse and illegal drug trade and sale. And so that unfortunately played out in this case as well. So you can see here years later, the daughter was arrested for felony theft and has been in and out of the criminal justice system for different reasons on numerous occasions. And so, you know, we talk about the importance of intervening and identifying these children, but it's important to do it in a positive way too, which really speaks to the importance of keeping children and their welfare at the forefront of our work, regardless of other, you know, statistics or performance measures that different professions might have. It's important to really keep that focus on children, because sometimes children try to do the right thing. You know, they think that they're reaching out, that they're putting themselves on a positive path. And for this girl, she tried to do just that, and it didn't really go, I'm sure, how she planned. And unfortunately, she was affected by some of these long-term effects.
We all have a role to play. And if we always keep the child as the focus, as Libby was just mentioning, always keep the child as the focus. And every little piece of information we have that we bring to the table, we have a better and better chance of intervening and possibly changing the trajectory of this child's life. The DEC approach, as we mentioned earlier, includes early identification, intervention, and services to children and their families. Research has shown that the earlier the intervention, the more effective the outcome will be. But also research has shown that there's a potential for change throughout life. And it kind of contradicts the notion that once the damage is done, it's done for life. In fact, there's now scientific evidence that even neuronal regeneration is possible given the right environment. So I want to read you a research study that was done, and this gets back to that nature versus nurture concept that we talked about earlier in this presentation. That really gives us a reason for optimism. This research study was conducted by the National Institute of Child Health and Human Development. So I'm going to, it's actually a pretty interesting study. About 15 to 20% of rhesus monkeys appear to carry a heritable trait associated with anxiety. In situations that most young monkeys would experience as novel and interesting, these anxious monkeys typically withdraw and become quite timid and nervous. To an outside human observer, they clearly resemble a human child lingering on the edge of the playground, looking down, afraid to join the other children. Compared to other monkeys in similar situations of potential stress, the anxious monkeys generate significantly more stress hormones like cortisol. Also, when they're given unlimited access to a sweetened alcohol solution, these anxious monkeys participate much more readily and heavily in monkey happy hour than do their less stressed out peers, an alcohol consumption pattern closely resembling what many alcohol and medical professionals among us call self-medication, in which the anxious or depressed patients seek to relieve their suffering by abusing alcohol. Yet when members of this same minority of supposedly genetically at-risk monkeys are cross-fostered at birth, and they're placed under the care of particular female rhesus monkeys that have been identified as especially capable and nurturing, we're going to call them supermom monkeys, the tendency towards anxiety and timidity disappears. So does the tendency to abuse alcohol. What's happened? An improved social environment has modulated a heritable vulnerability. The researcher in this study, Suomi, has also wrestled with the genetic and social influences on aggression and impulsivity. In some rhesus monkeys, a variation in one of the genes associated with the neurotransmitter serotonin seems to predispose the monkeys not towards anxiety, but instead towards aggression and poor impulse control. These aggressive monkeys also drink lots of alcohol at monkey happy hour, and they're more likely than either the anxious monkeys or the other monkeys to engage in binge drinking. Typically, these overly aggressive young monkeys are not well liked or accepted by the other monkeys for obvious reasons. As a result, they fare quite poorly in monkey society with high rates of mortality. Sounds very similar to what happens in humans. Yet when these same genetically at-risk monkeys are raised in supportive environments, the harmfully aggressive behavior disappears, as does the excessive binge drinking. But there's more. These potential at-risk monkeys don't only survive, they flourish. They do very well. They appear to be especially successful in making their way near the top of the rhesus monkey social hierarchy. What's happened? Once again, an improved social environment has changed a heritable vulnerability into a positive behavioral asset. So I say one more time, we all have a role to play. We all can be the eyes and ears to recognize early identification and intervention, because there is a chance for optimism here. It's never, never too early to intervene, and it's never too late. The important thing here is once a child is identified, we need to intervene. Our vision, once again, at National Alliance for Drug Endangered Children is 100% healthy, safe children, families, and communities, free from the negative impact of substance misuse and drug activity. 99% isn't good enough. We need 100% healthy, safe children.
Thanks for sharing that example, that study, Marty. That is really interesting. And I think, that's it's a good note to end on. I think that there's a lot of hope still. There's definitely things that we all can do differently to change the direction of these children's lives and to provide better supports for them. So on that note, we're going to show a video that just kind of highlights the positive impact we can have and the hope that's out there.
Children are our future, and if there's one child in trouble from a parent or caregiver's drug use, that's one child too many. it's not too late to change this, to reverse the cycle.
I love that video. It's such a positive note. Before we go today, I want to tell you about the Check Deck mobile app that National Alliance for Drug Endangered Children is releasing to the public today. So you guys are the first people to hear about it. So National DEC has this mobile app that is available both iOS and Android. So go to your Apple store, go to your Google Play store and download this app today. Check Deck is the mobile app, and you'll see the National DEC logo at the top. It's geared towards 3 different audiences: people that are personally affected by drug use, people that are very concerned about them, and professionals who work with them. So I didn't take screenshots of the whole app, but if you look at this screenshot of the landing page, you can see the different categories there. And so if you are, or if you're a professional and you click on that arrow, it has different subcategories. And the subcategories go everything from basic needs like housing and rental assistance and heating and that kind of stuff, to foods, addressing food insecurity, counselors, therapy centers, all kinds of things. It also breaks down. We don't actually, I'm saying this screenshot was taken before we redid it. What we did was at the top, there's one for crisis helplines, because we want you to be able to click on that first if you have suicidal ideation, or you're very concerned about poison control, etc. So we do have one for that too. But it has all these subcategories. And what's really cool is you set the app for your location, and then it geotags the different resources in your area. So you can use this app and get real help in your particular area all across the United States. It's only available in English and Spanish right now. That may change in the future, but right now it's only available in English and Spanish. And you see at the end where it says English and then there's a down arrow. If you wanted to change it to Spanish, that's where you'd hit. We also, since we took this screenshot, have added our LinkedIn and Twitter links. But anyway, it's very cool. It has real life stories. And if you click on that real life stories, you can actually go to a page where you can submit your own story. And because we want to hear from people, this is only going to be usable if people contribute to that. And it could be a grandparent who's raising their grandchild. It could be somebody who was drug involved and they've come out the other end and they want to share their story of hope. We also have support videos. Some of them are done by experts in various fields, and you can watch these videos and learn from them. There's also a news feed that picks up on keywords, and it has constant update on stories going on in the news. So it's really great. This is phase 1 that you're looking at right now. As time goes on, we're going to be able to actually help state alliances to put data in and be able to collect data for them. So when they go to write grant reports, et cetera, something like that, they have a spot for that. Also, eventually we want different alliances to be able to talk to each other. And so there will be some HIPAA protections there, et cetera. And it will be very, I'm not sure what the right word is, when you control who can access it, et cetera. So anyway, I'm really excited. I hope you all go and download it today, because you are the first to hear. Today is the day.
Thank you for sharing that information, Marty. I'm really excited about that app, and I think it'll be a great resource for everybody. So thanks for letting us know that it's available now. This is, just my contact information. If there are questions that come up at a later date, you can always feel free to contact me. If you are interested in bringing this awareness training to your community or a different group, please get in touch with me. We can definitely set that up. I'd be happy to look into that. And I think, we do have a few minutes here, so we can take some other questions right now too, if there are any. I see in the chat, somebody has asked for a link or handout about the rhesus monkey study that you mentioned, Marty. I don't know if you have that link handy.
I do not have it handy, but if the person could put their contact information in the chat, I'm looking at the full screen here. Let me see the chat if their contact information is there. No, Bethany, can you?
Yeah, or I can, or maybe we can send it to Sarah or one of the organizers if they're able to put that to everybody.
Yeah, if there's any links or resources that we could share with the group, definitely send them to us and then we can get those out to folks. And we'd like to be able to share the PowerPoint if that's all right with you guys as well. Another thing that people were asking about is links to the videos. So either the one that we couldn't get to play or some of the other ones we've used. Is there a place that people can go to find that kind of material, to find those things?
So yeah, on the National DEC website, there's a lot of great resources. There are some other trainings as well that are self-paced, and I believe those are free to access. So I'll put that link in the chat here. And we could try, if we have time, we could try to show the video still. But I believe there was one other question somebody had.
Yeah, and I also want to.
There was a question in the Q&A part. We had the chat and then the Q&A, and people were using both, which is great. Someone was asking about what is the genetic factor of addiction if there's no environmental factors? For example, a parent who is in active recovery already before the child is born.
Yeah, so I think, to me, this is really related to what Marty was talking about at the end with that study of how, the nurturing and protective factors make a huge difference in the study for monkeys, but also we know for children, for humans, it makes a huge difference as well. So I think, to me, I would say, sure, there is this genetic or nature factor of addiction that some people just are more susceptible to that sort of brain chemistry than others. But I think that the protective factors of having a parent in active recovery would be hugely beneficial and a really positive thing. But Marty, do you have any other comments?
Yeah, I want to bring us back to that one slide that said we all can play a role, because absolutely a parent in recovery can provide a protective environment for that child. And we see it all the time where someone may have a past of addiction and they're able to live a very successful, healthy life. But we all can play a role in protecting that child. A simple example of the playground duty at school, understanding, just having some education to understand what impact being exposed to drugs can have on a child, and be supportive of that child. The person in the grocery store that interacts with that person, everybody who comes in contact, the children on the street, moving from get off my lawn to, hey, I saw you shooting baskets, last week down the street, and you're really pretty good there. Everybody can protect children and make that protective bubble around them.
Absolutely. Yeah, that's a really good point. Let's see, are there any other don't see any other questions at the minute or at the moment.
I'm going to get back to the Reese's Monkey link. Was it Bethany? I've got our email address right there, info@nationaldec.org. If you could email that question there, then I can respond to you. And I'm going to go back to the slide of Libby's information because she's your Michigan person.
So yeah, again, just feel free to contact me. We have this awareness training that we can offer. It's meant to kind of just introduce communities to the concept of drug endangered children, who is that population, and then what we can all do to identify and provide better supports and kind of work together to improve that service to the population. So we have this training. As I mentioned, there's a lot of resources on the National DEC website. There are other trainings too that we can provide that focus more on how to bring together a multidisciplinary alliance, how to build a collaborative effort at the local level. So there's different things that we can offer. And I'm, like I said, happy to get in touch with anybody about this project.
Are there a couple more things in the chat there? I don't want to stop sharing my screen because I want to keep your info up there, Libby.
Yeah, no, I don't think there are any other questions other than just somebody did ask about if we're able to put a link for the first video that wouldn't play. I don't know if we want to try to play that now if we have a couple minutes.
Yeah,
or...
I have one more idea that might work. Let me try this. The other thing I'm thinking of is it did work when I tried to play it from this. See, it's not working at all. Okay, I'm going to hide it. It seemed to work when I was hiding it. It's driving me
while
crazy.
you guys are playing with that video, there's a question that we've asked a lot of our presenters throughout this webinar series, and it's how have you seen an impact or change from the COVID-19 pandemic? Have you seen the things we've experienced as a country and as a society in the last 18 months now? Have you seen that affect things in your arena, in your scope of practice? And if so, could you speak a little bit to that?
Yeah,
Absolutely. Go ahead. I'm sorry. Go ahead, Libby.
No, I know that, I don't know the specific survey now, but I know there have been a lot of reports that substance misuse and alcohol misuse have just risen dramatically over the past year. I think, there was kind of a downward trend for a number of years, which was great to see, and especially with opioid use as well. And that has kind of gone the other direction, unfortunately, since the pandemic. I think, there's just been so much stress and anxiety for a lot of people that's resulted in increased substance misuse. So that definitely has an impact on whole families, obviously the individuals personally who are struggling, and of course their children too. And the other, I think, big effect for the drug endangered children population is that for, maybe a year or more for some kids, they weren't in school, they were just at home all the time. And for some kids, home is not necessarily a safe environment. So that adds a lot of negative immediate experiences and potential long-term outcomes, and a lot of stress and anxiety for that population as well. Marty, do you have anything else?
Yeah, I'm just going to actually piggyback off what you just said. Here in Nevada, our reports of child abuse allegations actually went down dramatically, but we know that the numbers of incidents didn't go down dramatically. What was happening is it was more confined to the home, and there was a fear that we're missing a lot more. So that's why it becomes even more important for everyone to play a role and be eyes and ears in their community, because you may be able to change the trajectory of a child's life simply by caring or being a positive adult person in their life. It's really important for everyone to keep their eyes open when they're when they're going around. And the other thing that has been interesting that happened during COVID is there was a lot of telehealth, mental health, and substance use disorder therapy treatment going on via Zoom. And what was interesting is that counselors and therapists have actually reported that it's been interesting to kind of look into people's homes while they were in the, if they do complete the call from their house, but they were able to kind of get a feel for what kind of environment the person was in. And that would be interesting information to have if there was children around. You know, then the counselor could actually bring the children into the situation, you know, as far as asking questions about the children and getting a feel for what's going on in that family's situation. I think we're right at 9 o'clock. Oh,
Yes.
sorry, it's 9 o'clock in Nevada.
Yes, it's noon our time. So yes, we have reached the end of our time together today. So I just want to thank you so much, Marty and Libby, for joining us today and sharing your expertise. And we will definitely get the info, any links and things like that out to the group today.
Thank you so much, Sarah. I was going to say too, at the National DEC website, there is a specific page for kind of some resources that are specific to the COVID-19 pandemic environment that might be useful.
Oh, great. Good to know. So yeah, definitely everyone check out that website, check out that app. That's fantastic. I think that's the first time we've had an app brought into one of our presentations. So that's just another tool that we can all use in our work. So today's presentation is one of many webinars scheduled throughout the month of September. You can still register for our very last presentation today at sccmh.org. It's a panel discussion with local leaders. So we'll be continuing this conversation and kind of putting a local focus on it. At the conclusion of our session today, a pop-up will appear on your screen with a survey. Please take a moment to fill this out and give us your feedback. Thanks again for joining us, everybody, and we look forward to seeing you at our last webinar.
Thanks, everyone.